I'm going to highlight here in the time that we have 2 studies. And one is a randomized clinical trial of the steps to respect. And this was a randomized clinical trial in 33 elementary schools in so there's essentially, this is 3rd through 5th grade classrooms. It's a 1-year pre-post data collection from school staff, teachers, and students, so multiple reporting. And here you see that of this sample, 25% were rural, 10% small towns, 50% suburban, and 15% mid-sized cities. Next slide. And so what were the program components of Steps to Respect? There's a program guide, developing an anti-bullying policy for the school-wide and parent components, gaining that staff buy-in, and then implementation information and training. The staff training was quite extensive to introduce them to the SEL framework and then how to implement and troubleshoot implementation. And then it added to this, remembering again back to the previous meta-analysis, that parents are very, very pivotal. There's an annual letter from the principal. There's a parent night materials and parent handouts, continual communication with the parents to understand what's happening. There's 10 skill lessons that focus on friendship skills, recognizing bullying, refusing and reporting bullying, but also bystander skills and identifying barriers to bystanders, and literature lessons which reinforce the Steps to Respect concepts as, while addressing language arts objectives, so integrating within the curriculum. So what did they find? They actually, next slide, they found from the teacher report that teachers evaluating the kids, there was an increase in social competence and a decrease in overt physical bullying with an effect size of 0.13. Next slide. From a student report, they found that teachers and staff were implementing bullying prevention, which makes sense. There was an intervention. And they found that students intervened, and they did it through positive bystander behavior. And also the teachers and staff were responsive to the bullying that happened. And remarkably, overall, there was an improvement in their perceptions of school climate, so school connectedness and staff climate. Now, next slide. I'm going to talk to you about now moving to middle school, the second step of program, that a randomized clinical trial that's funded by the Centers for Disease Control. And here we have a group of 6th graders that we have now followed who are in 8th grade. They have received 15 lessons in 6th grade, 13 lessons in 7th grade, and 13 lessons in 8th grade. And next slide. Within these, there's 5 program themes across this middle school curriculum from 6th to 8th grade, and that includes empathy and communication, bullying prevention, emotion management, problem solving, and because both bullying victimization and being a perpetrator of bullying is increasingly becoming associated with substance abuse prevention, there's substance abuse prevention programming within each grade level as well. Next slide. So what did we find? And I'm presenting here the pre-post in the first year where the kids received, the 6th grade received 15 lessons of socio-emotional learning. And what we found at randomized clinical trial, that individuals in the intervention schools were 30% less likely to report fighting other students. So physical, again, that physical form of aggression and bullying was reduced substantially in intervention schools in comparison to control schools. And so those are showing some promising results of the use of socio-emotional learning. And so I'm optimistic that these types of programs will be considered. So overall, as we've talked today, there's lots of things that we can talk about implications for prevention program, but it's very, very clear that just giving kids definitions of bullying and knowledge about bullying may not be pushing us in the right direction, that we need to give them life and social skills and communication skills around the social-emotional learning kind of goals that we have. We also need to consider developing secondary and tertiary programs, not just these universal prevention programs, but think about what else kids might need. It is very clear that anyone that's doing bullying prevention within middle schools in the United States needs to not only consider but definitely incorporate a discussion of sexual harassment and homophobic language. If it's just do not allow that homophobic bantering to occur, that's a good start. And then we have to recognize that the peer norms within the context of middle schools is not only contributing to the onset of bullying in our schools, but is contributing to the sustainability of that. And so we have to think about what are those pro-social ways that we can encourage peers to engage in that pro-social behavior. I thank you very much for your time.